Peace and blessings, everyone. Hello, good evening. My name is Rehana Sidat, and I am founder of Jamila's Legacy, which is a non-profit community organisation based in Leicester. We have been supporting and educating communities and organisations in mental health and wellbeing since 2015. And today we are going to be talking about navigating the mental health field as a client. And with me, I have three very special guests, three psychotherapists actually with us, who are now going to introduce themselves. And I'm going to start with Shereen Sidat, please.
Hi, I'm Shereen. I'm a humanistic and integrative counsellor psychotherapist. I work in private practice and I'm also a qualified supervisor. Yeah.
Thank you. Myra, can I come to you next, please?
Great. Hi, thank you for the invitation to be. I'm looking forward to tonight's discussion. So I'm Myra, I'm an accredited counsellor. I'm also a supervisor and a counselling tutor, and I'm the founder of the Muslim Counsellor and Psychotherapist Network, the MCAPN.
Wow, I look forward to hearing a little bit more about that. Sounds like you've got a lot going on there. Wonderful. And my final guest, Sahar, would you like to introduce yourself, please?
Assalamu alaikum and good evening to everybody. Thank you for the invite. It's really nice to be here and looking forward to the questions and the talk. I'm a psychotherapist by trade, and I also am the founder of MindworksUK. It's a low-cost counselling organisation, and we also take trainee counselling placements as well. Alhamdulillah.
Wow, mashallah.
And my modality is very integrative nowadays, actually. So change from just purely humanistic, so like Shereen, very integrative.
Wonderful. I'm going to come back to modality in a little while because I'm sure our listeners will want to know what is all that about. But before I do, I just wanted to focus on our topic. So the topic is navigating the mental health field as a client, and we're focusing on how to find the best counsellor, therapist for you as a client, and the questions that you may need to ask. And I often get, people speaking to me and inquiring about counselling, and often they don't have a clue. And it's quite a minefield. The mental health field in itself is quite a minefield. It's very confusing. And so, for a layperson who doesn't know anything, especially at an extremely vulnerable time, everything can feel very overwhelming and very confusing. And this is the reason why, we're all here today to talk about this and hopefully to help people and simplify some of it. So some of the kind of questions usually are, I'm seeing a psychologist. Well, that's the same thing, isn't it? Or I'm under a psychiatrist, consultant psychiatrist. That's the same thing, isn't it? Or what is the difference? So I'm asking you, what is the difference? So, what is the difference in terms of a psychotherapist, a psychiatrist, a psychologist? They're all psys. It's quite confusing. So, Sahar, would you like to maybe briefly explain to me? I know we could go into this and carry on and on and on, but if you could briefly explain to me, what are the differences?
Absolutely. Obviously, it depends on where you've been referred, how you've been referred. So usually through GP referrals situation and what your mental health, emotional health is like at that point, you could be referred to a psychiatrist, psychologist, or psychotherapy and counselling. So I'll start with the psychiatrist, who obviously has done many years of training. You're a doctor first, and then you'd go on to more medical training for medication and so forth. And it's where you will have an assessment from many people might have heard a psych assessment. That's kind of the terminology, but it's a psychiatric assessment to establish really, what is actually going on for you. Which pathway do you need to be referred to, whether it is a psychologist. So the psychology route is really someone who will really go really into your deeper self, your history, your childhood, really focus on that more so than you would with a psychotherapist, sorry, stumbling my words, more so than with a psychotherapist or a counsellor who would work on your everyday, what's going on for you now in the here and now, and looking at more solutions for you on that route. And obviously we're going to go into more of the education side as well, and there is different routes on pathways for education and qualifications as well.
Thank you so much, Sahar. That was really interesting and done very nicely briefly, but may I just ask my other guests if there's anything you wanted to add? Are we okay with that? Okay, lovely. My next question is actually for you, Myira. So Sahar's just touched upon qualifications and training. So we're looking at the counsellor psychotherapist. What that's the area we're looking at. So what's the difference there? That, you know, you've got two labels and often people use both of them. What's the difference there before we go into the training side? Is it about the training?
In a nutshell, yes, in the sense that what's the training you've received? So therefore, then what's the label you're going to use? If you've undertaken counselling training, you call yourself a counsellor. If you've undertaken psychotherapy training, you call yourself a psychotherapist, or therapist for short. Now, in terms of what that actually might look like in the room, I think that is more to do with the distinction between different modalities of therapy. Like we've already heard Shereen and Sahar both share what modality of therapists they are: integrative, humanistic. I'm psychodynamic. So I think it's about not necessarily the title that practitioner is calling themselves by, but actually I think it's about the modality, the type of therapy they can offer to you as the client. So I think
so either of those they mean the same thing. Yes,
they're interchangeable in the sense that both counsellor and psychotherapist, what they are both fundamentally doing in the room is offering you a talking therapy, okay, or a therapeutic process. And what actually distinguishes one counsellor or therapist from another is the modality of therapy that they're going to give you.
So Myira, this word modality, explain that to me, please.
So modality in a nutshell is essentially the type of therapy or the theoretical background of the therapy that they're giving you. So if we think about how a therapist is going to offer you their therapy, it's because they've been trained in a particular theoretical model in how to deliver that therapy, and hence the word modality derives from the word model. So whatever model a therapist can offer you is their modality. Now, there are some very common, much more popular, much more available modalities than others. But I think in terms of number, to this day, I think we can count over 300 modalities. But there are maybe kind of up to 10 of them that are the most common ones, and ones that you're going to find to be much more easily accessible. And so the ones that most clients or potential clients may have heard of would be things such as CBT, person-centered, humanistic, TA is another one, psychodynamic, which is my modality, and then there's something which again has already been mentioned this evening, is integrative. Now, integrative is it's a modality, but it's a modality that has taken 3 or 4 of those pure modalities and teaches the therapy how to use with multiple modalities at the same time. So, for example, I can ask Shereen and Sahar, both say that they work integratively. As a counsellor, my follow-up question would be, you're integrative, which modalities? So if you think of integrative as like an overarching umbrella term, I would then be interested in which modalities do you integrate?
So that could be a question. So when somebody says to you, I'm an integrative counsellor, and so you go into, I mean, and as you said, there are so many, there's even DBT, EDT, and I was thinking Gestalt, so many started coming in my head, and I was thinking, actually, that's a really good idea. But you don't necessarily, as a client, need to know all of this, but it is worth, I think, doing a little bit of research.
Yes.
Before you go ahead. And what I would say, and I'm sure all three of you will agree with this, what you don't know, just ask in the room, ask whatever it is, ask the question. Don't leave it and then it bugs you and bothers you. Sometimes it can get in the way of the therapeutic work. So rather ask the questions, because I'm sure, you're all therapists. It's okay to ask these questions.
Absolutely.
That somebody questions, what are your qualifications? What are your experiences? What is your practice? After all, you're going to be, my very personal things are going to be shared, and in a sense my life is in your hands, if you know what I'm trying to say. Not in that context, but things that are so deep and personal that maybe are never going to be shared anywhere except in that room, or with you as a therapist. So I think it's very precious, and I think definitely asking those questions reduces, if you're like me and are anxious, would reduce the anxiety and reassure me. So I think, because sometimes the judgment can get in the way, because I've made a decision from the first time I've seen you and I've not asked the questions I want to ask. And then I've gone away thinking, and it's become a barrier, and I'm speaking from experience. So I want clients and potential clients to think about these things. So yeah, that's really good that you've explained that. So going into the training bit. So when we talk about qualifications, so a lot of people say they're counsellors, people are setting up, and yet I'm looking at the training qualifications and I'm not really seeing much. And I'm thinking, well, can you qualify with a level 3? Yet people are going to university or doing a master's on the other end of the scale. And I'm getting very confused, how many years of practice? And obviously, are they BAC approved? So British Association of Psychotherapists and Counsellors. Are they on the counselling directory? You mentioned your own network. So yes, it can get quite confusing. So can you tell me, Myra, what qualifications do you need to become a counsellor?
Well, what's really interesting is that from a purely legal standpoint, because the profession is unregulated, there is actually no legal requirement to have any training to set up as a counsellor or psychotherapist. They are not protected titles. So in that sense, the profession, on a very broad, basic sense, can quite quickly feel like it's a bit like the Wild Wild West out there. Now, in order to compensate for that, in order to actually bring in a level of professionalism, professional standards, this is kind of one level shy of regulation. And what the profession has then done is they've kind of rallied together and gone, right, well, let's just self-appoint or self-apply professional standards. So across the board, what we now have is professional bodies, counselling and psychotherapy professional bodies that now set their professional standards for what they will determine is qualification level. And the commonality across all mainstream majority professional bodies is that the minimum qualification for you to qualify and join that professional body as a counsellor or psychotherapist is a level 4 diploma.
So level 4 diploma.
A level 4 diploma and higher or higher. So people can go in and qualify with a level 5 diploma, a level 6 postgrad diploma, or a level 7 master's. So if you qualify from any one of those levels, you are deemed a qualified counsellor and can join a professional body. Now, the confusing part is that for many people is that they then think that, oh, I need to work my way through all 4 levels. I need to do a level 4, then I have to do a level 5, then a level 6 and a level 7. No, you don't. As long as you have a minimum level 4, any one of them, and it meets the requirements of the professional body, you can then go and register with that professional body. The difficulty or the trap or the danger in the profession, 2 things. One is that because you can advertise as a counsellor or psychotherapist without qualifying to that level 4, there are many counsellors and psychotherapists out there then that advertise but are not qualified. So one of the main questions as a client looking for a therapist or counsellor is you ask them what their qualifications are. And any counsellor worth their grain of salt will quite openly and transparently tell you and share with you their qualifications. So absolutely, question number one, the biggest question you will ask to any counsellor or therapist that you're looking to engage with as a counsellor, as a client, would be ask them what their qualification is. That's kind of one of the dangers of the profession. The other danger is that in order to actually go on and train at a level 4 or above, you have to often, well, actually you do, you have to have done prerequisite training levels, which is the level 3 you mentioned, Rehana. So there's a level 2 and a level 3, which is called counselling skills. Again, the thing that for a potential client watching this, please make sure that if you're, again, asking your counsellor for their training qualifications, that they're not just fobbing you off with a level 2 or a level 3. That's just counselling skills. It means that they have not undergone any supervised clinical training. All they've done is classroom-based theory.
Myra, so what
yes.
supervised, you mentioned supervision.
Yes.
So
when you're training at that level 4 or above, as a counsellor on one of those training programs, you are both doing classroom-based theory and you are then on placement working with real clients, and you're having to get a minimum number of client hours in order to qualify. So it's like you're doing the job as you're training, a bit like a trainee doctor. I'm doing my training and I'm also on the wards working with patients. It's a similar thing.
Can I ask how many hours or how long do these placements last?
Well, again, it depends which level, and that's the distinction between the 4 levels. At level 4 and level 5, it's a 2-year course, 2-year diploma, of which you will start working with clients in your 2nd year, and you need to get a minimum of 100 hours, 100 client hours, in order to qualify from a level 4 or level 5. Where it really steps up is that you start getting into your level 6 and level 7, your postgrad diploma or your masters, which are both offered via universities, and then you're starting to look at a higher number of client hours. The courses can often be longer. For a master's, it can be minimum 3-year course, which is your level 7 master's 3-year course. Very often they're looking for around 450 hours in order to qualify. So somebody that has a level 4 or level 5 qualification may have less client hours when they at the point of qualification. But of course, that does not necessarily signal how many hours they've gained since.
Okay, so I'm going to ask the question. I get a lot of people who are interested in this field,
yes,
and who want to do it because they themselves have personal experiences of struggling with their mental health problems, but and they want to help others. But what checks are in place to make sure they're well enough to be undertaking this type of work? Because this work is not easy, you know, and it's you've got to take care of yourself as a practitioner as well, but also the responsibility you have in the clients that you're going to support. So you touched upon quality assurance. I just want to know what checks are made before people embark on these courses.
Well, very often to get a place on a training course, that's why those prerequisite levels, the level 2s and 3s, can often help, because they do a number of things. One is that they give people a taste of the skills in role play practice, and also starting to introduce them to theory for them to really figure out, is this what they really want to do? And it can also serve as a filter for students on these courses to go, not for me. But also there are interviews to get onto those higher levels. So to get onto a level 2 or a level 3 course, because it's considered skills practice, lots of people will go onto those level 2 or 3. It's quite easy to get onto a level 2 or 3 course because you're not working with real clients and it's skills-based practice. But they do a good job of filtering out people that go, it's enjoyable, it's fun to learn a skill, but I don't want to be doing the actual therapy work. But it's at the point that you apply for a level 4 or above, because they're your qualification levels, because that's what we call your core training. They then have very stringent interview processes to decide whether you are suitable to be going on to that training. And a lot of that suitability is around your level of empathy, your level of emotional robustness or resilience, that's what we call it. but also your level of reflective ability, your ability to sit and be in relationship with people. So these are very humanistic, very integral relationship dynamics and skills that they're looking for you to have.
I'm really pleased to hear that, actually, Myra. So what you're saying is, from level 4, that is being assessed. And so if you are going to be looking into finding a counsellor, level 4 upwards, is that's what you will start getting. Yeah,
absolutely. Yeah, I mean, and that's why I say that the number one question that you must ask when you're looking to engage a counsellor or a psychotherapist is, you ask them what qualifications they've got. And if they cannot produce with you or show you a level 4 or above qualification, for me, that would immediately rule them out. Okay. Because they've not undergone rigorous training.
Excellent, thank you. And part of their training, am I right that you've got to have your own therapy as well? Is that
it's
right?
Not mandatory, but for a lot of the training courses, it is part of that individual training courses requirement. So I deliver a level 4 diploma. I teach on a level 4 diploma. For our students here, it's mandatory that they undertake their personal therapy whilst they're in training with us.
And I suppose that safeguards them as well. Yeah. So yeah, so it's
but
not
also,
just...
could I come in as well, just to say that because we offer placement, so after much discussions and debates on this, we've also made it mandatory that when they are coming on their placement, that they are in personal therapy for the whole duration of their placement with us.
That's really good.
It's really important.
Yeah.
And I suppose it's safeguarding everybody as well. So
absolutely. Yeah.
Thank you.
And it adds to the robustness as well, like you talked about, Myra, of the training and what you're delivering and offering.
And that follows on really nicely to my next question, which is for you, Shereen. So what kind of questions, I know we touched upon it earlier, that ask whatever you need to ask, when you meet up with your therapist or speak to them over the phone, or whether it's a Zoom session, whatever way you're going to have your sessions, that initial first meeting, what kind of questions should a client be asking the counsellor, the therapist?
Yeah, so as Myra said about the level of training that they've had and what qualifications they have, obviously that's top priority. And thinking about, I guess it does depend on whether you're looking through privately, accessing counselling and therapy privately, or whether you're going to an organisation and you're being referred to someone. Sometimes you might not have a lot of say in who you get, and you might not have a lot of choice. But I guess general things like if you're wanting to choose the gender of your counsellor, or whether you want it to be online or on the telephone or face-to-face, I think you probably have a bit more say there. But other things, if you are looking privately, you might look into how much experience someone has, what their age is, what their religion or ethnicity is. I guess if you're looking for specific parts of your identity to be affirmed and validated and understood, and that you're seen as a holistic person, as a whole person, you might be looking for certain things like that. And I guess then you might go to organizations that offer you certain that kind of tick the boxes or certain criteria. So you might want a Muslim counsellor, you might want a female counsellor, or you might want someone who has a very, very different experience to you. And it's about what you're comfortable with and what you're looking for to get out of the therapeutic relationship.
So obviously that those choices can be limited if it's therapy that you're accessing through the NHS. Yeah. However, obviously, if you're going down the private route, then you're able to, basically.
You'll have a lot more choice then, because you're the one embarking on that and not being assigned a therapist.
Myra, Sahar, do you have anything to add on that? Okay, I'll move on to my next question. So Sahar, this one's for you. Questions to ask the counsellor, therapist, and then I'll ask the others as well. What kind of questions, do you think that we need to ask the counsellor, therapist once I know it kind of links in with what Shereen has already said, but what other things besides the training, besides the preferences, what other things should we be asking the counsellor?
I think one of the other things would actually really be their actually own experiences in having counselling themselves, what their experiences are in their own life. Because we go through life and have lots of different experiences, and that's what brings us to counselling. You mentioned earlier, Rehana, about, you know, people studying it if they've gone through something and they want to give something back. So really asking, you know, what actually life experience do you have in the field or personally that's brought you here? And it's okay to ask.
Is that not some professional boundary, or, you know, some
really,
some therapists are very, they, you know, they're very they don't like to share anything, and I you know, I've been in therapy where they won't share anything, but then I take that personally sometimes and think, oh, and although it's not, it just comes across to me, oh well, I was only asking, you know, kind of thing.
Well, I get asked a lot, you know, what experience do you have? What life experience do you have that, you know, because it's such a sacred space and it's such an intimate space. And like you said earlier, you know, you're sharing your all, yourself in that space. So, you know, I am asked from clients, you know, what experience you have in life that has brought you here? How did you become a therapist? You know, they have it might be their curiosity, but a general interest because it's all about them. And I'm very transparent how I've got here in my training, how I've got here in experience. So these are questions I think that are really important to ask. And I think, you know, people do shy away from asking. And I think it's one of the key things that needs to be kind of there on the floor. You know, where have you come from? You know, and also and I know Myra very eloquently has put in, you know, talked about the education side and the qualifications. I think that's really important. You know, the accreditation, are you accredited? Are you working towards accreditation? You know,
so that asking about really, so to ask, are you accredited is a valid question.
And it doesn't mean if they're not accredited, they're not a good counsellor. They might be working towards accreditation.
Yeah,
and
you mentioned, it does take
a bit of time.
Sorry, Sahar, I didn't mean to interrupt you. So you mentioned your charity, you have students on placement. So it could be, you know, a client is asking them, so they're able to say, I'm in training, you know, and which is okay too. So it's that openness and being transparent, you know, it builds,
and given a choice.
Trust.
Absolutely. And being given a choice in, you know, we have trainees and we have qualified. So we say we have trainees because of the low cost counselling service we provide. Would you, you know, they are offered and they say, well, actually, no, I prefer to have a qualified given the scenario. So we know there's a different level of clients we can get as well. So we want to give a client, you know, a really traumatized client, for instance, or victim of serious crime or something. It has to be something that's manageable for them as a trainee, but also enough for them to gain that experience to the next level. So
anything to add there, Myra?
I had it's a bit of a two-parter question in terms of what questions you would ask your counsellor. So thinking off the back of, right, what qualifications, what training have you done? For me, the follow-up after that is always going to be, what experience do you have of working with the issues I want to bring? And that's kind of part one of my question. So what experience do you have of working with this issue that I want to bring to counselling? And second of all, how do you understand and work with this issue? This for me links back to the modality piece, because between myself, Shereen and Sahar, we can all sit here and go, yes, we might all work with grief and bereavement, but how we might work with it will look differently. And what our experience of working with it will look differently. So so two-parter question. What experience do you have working with the issue I want to bring, and how do you work with it? For me, that's really telling in whether then, from a client's perspective, this is the counsellor you want to be working with. So just as much as Shereen said, you've got all of the preferences, your counsellor on paper might tick all the boxes. So you add in the questions that Sahar's mentioned, or they've got personal experience of it. And then you want to ask the professional side of things, which is, well, what's your experience of working with this issue professionally, and how do you understand it, and how do you work with it? And I think for me, that's a really good, holistic, rounded way of thinking that this might be the counsellor for you, because they understand it personally, they understand it professionally, and you think it's going to be a good counsellor-client match relationally in terms of their kind of identity. and yours, and that's what you're looking for in the therapeutic relationship.
That's really, really helpful. And that's some really, really good things to think about there. Myra, so if they're not a good match, what happens then?
Well, a couple of things. I think one, from a client's point of view, if you don't think it's a good match, then absolutely speak up and say that to your counsellor. Again, a good counsellor is going to want to have that conversation with you and to give you space in the therapy to really think about why. My default question as a counsellor is always why, for example, in this situation, it would be, why is it not a good match? Now, I'm not going to be asking that question to the client directly, but I'm going to be sitting there and opening up a dialogue to think about what has gone on here in our work together, in our process and in our relationship that means that it's not a good match. What is it that I'm not giving to my client? And also, what needs do they have from me that I'm not meeting? So actually, I think it's really important to have that conversation. Now, off the back of that conversation, the client might still feel like it hasn't changed, that you're still, you're still a bad match for me, still not a good match for me. But what you're doing is you're offering the client options then to really think about very consciously what they want to do next. Now, that might be a number of options. One is they'll end with you and they'll go and shop for another counsellor. Great. Another option might be, oh, I figured out what it is, but actually we can work on that in the work together, and they stay with you. So for me, it's about, as a client, hold on to your autonomy, your level of choice and agency in this. And second of all, have the conversation with your counsellor, because it might actually be something that can be repaired in that work with that particular counsellor, and you don't need to end it. But equally, don't stay with a counsellor just because you feel indebted, or you feel like duty bound, or you feel bad that you're going to end. If it doesn't feel good, if it doesn't feel right, and even after talking about it, you still want to leave.
Yeah. So you're free to leave, especially in private practice, whenever you want.
Absolutely, yeah.
And you're paying for a service, and if you're not satisfied, you can change. Okay, that's good to hear. Is there anything, Shereen, you wanted to add on that one?
I imagine, Sahar, you obviously, because you offer counselling from an organisation, that the same would be true there, that if there is genuinely someone who doesn't feel like it's the right match, that they can speak to their therapist and then maybe be referred to someone else.
Absolutely. And also, we offer the in-house supervision, and I know we touched on that earlier, and that is, hand in hand with everything. So, clients may say, well, are you supervised in your practice?
So when some of you, I think all three of you mentioned supervision, that you're all supervisors. So what does that mean? Sahar, you've just mentioned it.
Oh, sorry. Yeah.
I've lost you there.
Actually, it's about, yes. Oh, sorry. It's about monitoring and evaluating the work that the counsellor is doing and carrying out to the best ability, and also ethically as well, because we have all the ethical frameworks we adhere to, and it's also safeguarding counsellor and client for any issues that might come up, and also a space for the counsellor to use, not just for the client work, but for their own CPD, for their own enhancing their education, and place to talk about it. And if there's any times not sure about, their own counselling approach, they can talk about it in that space. And it's space which is, again, very sacred to be used for the counsellor.
That's really reassuring that therapists are in supervision as well, whilst they are practicing. Myra, did you want to add anything there?
Well, just to really mention that all counsellors and therapists, from the moment they start their client work, are in mandatory supervision. So I think it's really important for all clients to know that every single practitioner, every single therapist and counsellor has regular minimum monthly supervision.
So these are accredited counsellors. We're not talking about the level 2 and level 3 counsellors. Who claim to be counsellors.
The moment you start your client work, whilst you are in training, so those students that start training in their placements, the very first client, from the moment you're given your very first client as a trainee, you start monthly or regular minimum monthly supervision. And you will have that forevermore in your career. As long as you are working with clients, you have to have mandatory supervision. So these kind of checks and balances, the support for the counsellor is there, that they have to attend, as I said, minimum monthly.
Yeah.
I'm really pleased to hear that. Shereen, did you want to add anything?
And that's regardless of accreditation, because you mentioned that it's nothing to do with it. Whether you're accredited or not, you have to have supervision regularly.
So I'm really pleased to hear that. That's reassuring. Before we end on this, I've got one last thing to ask, and then I'm going to focus on the living crisis. So my last question on this area is, how do I go about finding a therapist in terms of where do I look? You know, is there some website? What do I do?
The short answer is yes, there is definitely websites. Again, I think it links back to Shereen when you were talking about preferences. Now, if you already have a particular preference of a counsellor, there are very specific counselling directories that you can look on. For example, having run the MCAPN, we have our own Muslim counselling directory on our website. So if you're looking for a Muslim counsellor, as well as a Muslim supervisor, we have both a counselling directory and a supervision directory. And there are a number of these kinds of more specialist counselling directories that you can just freely search on the internet. Equally, there are lots of mainstream or general counselling directories for which you're going to be able to then specify and select the type of counsellor you're looking for. So things such as all the professional bodies, they will have their own counselling directories on their website. And then there are some mainstream counselling directories. One is actually called the Counselling Directory. So on there, you're going to get the full range of different modalities, genders, faiths, ethnicities, and locations. And that's a very generic, broad directory that you can then search on. But equally, there are these specialist directories that are either faith-based or ethnicity and race-based, or specialist interest-based as well. So depending on what your preference is, what you're looking for, there are some specialist counselling directories out there. But yeah, for faith-based, if you're looking for a Muslim counsellor or supervisor, there is the MCAPN directories on our website.
Thank you so much. Right, so Sahar, I wanted to talk to you a little bit about, we're in a living crisis, and given that we are in this crisis, do you think that the demand for mental health support is increasing? I'm going to ask each and every one of you, because you're all in practice, you're seeing clients, and I'm sure you're getting the responses. Sahar, what are your experiences?
Yeah, certainly as an organisational point of view, we're having many people access the service, and the demand is high. It's so high that we are signposting. So we signpost to MCAPN and to various other local organisations in the community where I am. We have, oh gosh, it's really sad, because many people now can't afford even low-cost therapy. And counselling itself and therapy privately is expensive anyway.
Yes.
And a lot of counsellors offer low cost, a minimum, they might say four clients per year, they'll do, at low cost, or 6. It's now, even for that, it's really hard for the counsellors to actually provide that service, because living costs have gone up for everybody, regardless of who you are.
Absolutely.
For those who are not very financially well off to be able to afford the higher costs, the low cost is even something they can't afford now. We have had so many referrals recently in the last couple of weeks that even the £5 is too much.
Yeah,
for them.
yeah. And I can understand that, because I think
really
we're looking at every penny at the moment.
Absolutely.
People are worried about how we're going to pay these bills, and the price of everything has gone up.
Everything has gone up.
And
your rent, your mortgage, your electric, your food, your
fuel,
everything has gone up.
And people are really worried. So I can see how, if you look at where your priorities are, that it's going to impact on health, and it is going to be, well, actually, this is a luxury. I know I need it, but right now I can't. But the impact of that could be people then reach crisis.
And there are, Rehana, and there are very few and far between agencies that can offer free counselling, but they are out there. So it is really worthwhile to have a look. And we offer low cost, and we're offering some free counselling as well. And it's around, we all, for organisations, it's really hard to get funding.
Yes,
but,
absolutely.
Many organisations at the moment are struggling, but they won't turn you away. They will either signpost to an appropriate place, or to an agency, or a directory. But we are really worried actually about the people out there.
And I think I'm seeing that. Obviously, Jamila's Legacy doesn't offer counselling. We offer a informal listening service and support sessions, and we're finding obviously people are using us often as an interim on waiting lists. So you mentioned charities. So charities that previously I was referring clients to, where there may have been a 6-month waiting list, is now a 2-year waiting list.
Wow. Yeah.
So it is very concerning, and I do worry. The same as you, Sahar, and I'm sure Myra and Shereen, you're seeing similar things. So Myra, do you want to add to this anything?
Just kind of echo what Sahar said, but also what you're saying, Rehana, which is that when therapy is seen as a luxury, and when people now are tightening the belts and going, right, we can only afford the essentials, therapy is very often the first thing that gets crossed off the list, right? So even here we're seeing at the service here that many clients are asking for reduced fees or are just ending counselling because it's this that thing of, well, we just can't afford it, and it's one of the first things to go. So we're definitely seeing that the irony is that as the demand for mental health services and support goes up, actually the accessibility, the availability, and the cost of it, or the access of money to pay for it goes down. And so it's this kind of inverted scale, unfortunately, that as the demand goes up, the availability and accessibility of it goes down. And that's really, it's like, and I echo what Sahar says, it's just really, really sad to see.
Shereen, anything to add?
No, just the same, echoing the same. It's been my experience too. Yeah.
So my final request to all of you is that what can people do about their mental health right now with what they have, what they're able to, do? Obviously, we've talked about counselling and how clients can get help and how to navigate the system. However, if given this living crisis, people are really struggling, what are their options? I mean, one thing that's coming to my mind, and I'm sure all of you can add to this, is whether if you're in private counselling, maybe reducing the frequency. I know it doesn't give the same benefits if you're seeing somebody on a weekly basis and then you're saying, well, I can't afford that now, can I make it bi-monthly? But is that an option? I mean, you're all therapists, I'm just asking the question.
Yeah, that's definitely something that
Go.
That's definitely something I've seen in my practice, where clients have been asking for fortnightly sessions instead of weekly, or they might be switching to monthly ones if we're kind of working towards an ending, or some have just ended because they're not able to. And that's kind of been happening over the last year or so. I've noticed that more, that even though the need is there, they have to think about financial situation first before thinking about their emotional kind of well-being and mental health.
Myra, anything from you?
I think yes, as from a client perspective, you can ask for a reduced fee. But I'm thinking also actually more broadly than that, I'm thinking about, well, what can also be done alongside it? So also it's about not just putting it all into therapy, it's also going, well, what can I do the rest of the week to help myself? And as much as self-care sounds cliche, I think for me, actually, I think it's about sitting with and honouring how you feel. And actually the word self-compassion comes to mind more than the word self-care. And for me, that is at the very minimum, at the very broad, at the very kind of foundational level, it's what's your relationship like with yourself? And so whilst we can go to therapy, whilst we can do lots of things externally that's about practically that's about self-help, for me there's also an internal job that can be done at the same time, simultaneously to accessing therapy. And I think a good starting point is, how do you talk to yourself? Are you treating yourself with self-compassion? Are you perhaps keeping a reflective journal? What are you doing day to day that actually means that you're taking care of yourself? And I think then therapy then actually becomes much more effective, but also I think it complements what you're doing the rest of the week. Therapy is not the space then that helps you cope with the rest of the week, but rather it's complementary to you looking after yourself the rest of the week.
That is really reassuring, and some great advice there from all of you. But Myra, that's great. So for those that are watching this, listening to this, I think there's some good tips there. If right now is not the time for you to have this therapy for various reasons, what are you doing in terms of not only self-care but the compassion that you can give to yourself, and the investment in yourself, and taking some ownership of your own mental health, and developing some resilience as well in the interim, I think are really important. So thank you so much to each and every one of you for taking your time out today and speaking to me. And I really hope that this has benefited people, and hopefully we will come together again and have a further conversation. In the meantime, thank you so much, everybody. Assalamu alaikum.